Hey, good morning, guys. This is Kimberly, and it's about 8:30 on Wednesday, December the 14th. I am extremely exhausted this morning. I did not sleep at all last night. You can see I'm trying not to shake the laptop too much, so I'm sorry if it's a little bit shaky. You can see that my bags and the dark circles under and around my eyes are getting a lot worse. And that is because I have not been sleeping very well at all for about the past 3 days. And that's kind of why I haven't made a video, in addition to dealing with some of the emotional aspects of everything that I'm going through. It's been a really rough couple of days, and so I wanted to do a video devoted to that. And so I'm just kind of going off the wall here. I don't really have a script, or I haven't really thought of anything particular that I'm going to talk about other than the emotional aspects. So, um, when you are dealing with chronic pain, and you are restricted in your life from doing the things that you once did, it is very traumatic, and it is emotional, and it is depressing, and it makes you feel like you're a failure in a lot of ways. And you will likely experience feelings of being hopeless, helpless, being an emotional basket case. 1 minute you're fine, the next minute you're crying. And despite putting on a good facade on the outside, and um, putting on this face to your family and your friends that you're okay, inside you're just really crying out because you feel really bad. And maybe not everybody will deal with this, but a lot of people do. And it's really not uncommon for orthopedic patients and patients who have lumbar fusions to be diagnosed with, or to deal with, varying degrees of depression. And people don't like to talk about depression. People don't like to talk about mental health issues. It's kind of taboo, kind of like talking about poop and pee and things like that. But you know what? This is real life, and the reality of it is that um, your emotions matter, and you matter, and it's really important that you take note of how you're feeling and how your emotions are. And if you start feeling depressed, and if you start feeling hopeless and helpless, or emotionally unstable, you need to talk to your doctor about it, and you need to ask for a psychiatric consult. Not so much so that you can, be diagnosed with something traumatic like bipolar disorder or schizophrenia or schizoaffective disorder, but so that you can get some help, because depression can spiral into a downward, horrible abyss of darkness that turns into suicidal tendencies and suicidal ideation. And you know what? I value you. I value myself. I don't want to see you in that position. I don't want to see myself in that position. Excuse me while I take a drink of water really quick. I've got my great little cup that I talked about in my other video, so sorry about that. So, you know, y'all know that I'm a nurse, and I have worked most recently with psychiatric patients. And over the course of the years that I've been a nurse, I have had the experience to deal with psychiatric patients in the ER as well, when they are in crisis, inpatient and outpatient. And depression is a real life thing, and it affects more people than you think. And it's nothing to be ashamed of, and it's nothing to hide. And if you are suffering from feelings of anxiety or hopelessness, helplessness, feeling depressed, irritable, being irritable is a really big sign of depression when you're dealing with chronic pain. Frustration, anger, feeling withdrawn, all these things are signs and symptoms of depression. And you know yourself better than anybody. I know myself better than anybody. And I know that I've been depressed. And I have been trying to hide it and trying to cope with it the best that I can. And I talked to my doctor about it. And, we are in the process of dealing with it. Now, I am not taking any medications for it at this time, other than I'm taking Xanax, because my anxiety has peaked, and it is to the point where um, loud noises make me really anxious. And it's almost like I have a little PTSD of some sort now, post traumatic stress disorder. I'm not quite sure because I haven't seen a psychiatrist or psychologist yet. But I want you to know that these feelings, they're all normal. And a big portion of the emotions that you're coping with right now, a lot of them come from the pain medications, because the pain medications are depressants. And if you don't have normal levels of serotonin and dopamine in your brain, you're going to get depressed. And so, these things happen, and it's not the end of the world if you cope with it and if you deal with it. So, some of the things that you really need to do is talk. The first thing is talk to your doctor, talk to your family. The second thing is you need to really try hard to use positive affirmations for yourself. One of the things that I've really had a hard time with is that I feel like I'm a disabled person. And I am. By all standards, I am. I walk with a walker at this point. Prior to that, I was walking with a cane. I went from being very active to being very inactive. My form of exercise over the past year has been walking through Target or Walmart on a daily basis, leaning over the shopping cart for support and to relieve the pressure on my spine. So, that's really depressing to go from being, active and running and playing with your children to all of a sudden you're walking with a cane, then you're leaning over the shopping cart. You, at first, are able to walk laps around the store, and then you have to stop and take rests. And then you're walking with a walker. And then by the time that you leave the store, the old man that's working at the front of Walmart, that's a greeter, says, "You know what, honey? I think next time you ought to use the electric cart." That's really detrimental, and that really is emotional. And that's been the biggest hang up that I've had, is that even though I know this is a temporary disability, it's a disability, and it sucks. And there's no way to get around that, and as much as people say that they understand that you're in pain, and that they understand that you're sad, and that they understand that you're going through a hard time, unless they've gone through it themselves, they don't understand. And that's okay. You know, my family has been spectacular, and they get it. They understand. But at the same time, they don't totally get it. And that's okay. And you know what? It's just this is life right now for me. And if you are going through this is life for you. And you have to try and be positive, and you can't let it get you down. And every day, you need to make that positive affirmation that you're going to get out of bed, and that you are going to do the hard thing. The easy thing, excuse me while I turn off my cell phone. The easy thing is staying in bed and doing nothing. The hard thing is getting out of bed and getting dressed and going and being active. So make it a point every day to get out of bed, to get dressed, to wash your face, and to do the best that you can to be active. And you know what? It's not going to fix everything, but it will start to get the endorphins going and start to help you feel better while you're waiting to see a doctor. And talk to your doctor, and don't be afraid to ask for help. Because it doesn't mean that you're a bad person. It doesn't mean that you're a loser. It doesn't mean that you are anything less than a person that's in pain and a person that's suffering. And you know what? I'm that person right now. And it's okay. And so I hope that you can walk away from this video and know that the feelings that you're feeling are okay to deal with right now, and that you just have to get help to cope with them. Because if you don't, they could turn really nasty really quickly if you don't have the adequate skills to deal with them. I'm fortunate that I've been really trained, and you know what, even though I'm going to be getting some help, I still know some ways to cope with it. So I'm out of time. I wish I could talk more. Maybe I'll do a second video a little bit later today. Have a good day, and I'll talk to you soon.